Now, the next exemption which we are going to do is the exemption of healthcare. Everyone, healthcare being the priority sector for the government, healthcare is the priority now. Now, healthcare, government is going ahead and telling Ramesh, if you are going ahead and providing any healthcare service, we will go ahead and exempt it because actually it is the job of the government to provide healthcare to the public. But if you are going ahead and doing healthcare of the public, don't go ahead and collect GST and pay to the government. Government is telling Ramesh, healthcare in public interest, I want to exempt it because it is the primary need of the people. Healthcare is the primary need. Actually, it is government who should provide healthcare to the public. But I am going ahead and helping the government is providing healthcare to the public. I am helping the government, and hence government says, Ramesh, don't collect any GST and pay it to us. Healthcare, everyone, healthcare services. It says over here now. Healthcare service. First of all, you have to understand what is healthcare. So, healthcare given by whom is exempt? Sir, healthcare given by hospital is exempt, healthcare given by doctors is exempt. But first of all, you have to understand what do you mean by healthcare. Let's first understand what is the definition of healthcare. I am going ahead and telling, sir, on the roadside I am selling eggs. That is also healthcare because I am doing good for the people. Selling eggs early morning, they are eating eggs and becoming healthy. That is not healthcare. You will have to read what is the healthcare definition as per the GST Act. Everyone over here. Healthcare services means, what do you mean by healthcare? One one Baba is there. Baba is telling with the broom, I am giving jhada, saying, okay, you will get well soon. Now you tell me one thing. Baba giving jhada, that is also healthcare as per the Baba. But government is telling we will define what is healthcare. Everyone over here. Government told healthcare means any services by way of any service if you are going ahead and giving by way of diagnose, treatment and care. Sir, one person he was not keeping well. He went to a lab. The lab diagnosed that he has some problem. Might be the lab diagnosed he has COVID. Now, diagnosis is also falling in healthcare. Now, he will be put in a hospital where the treatment will be done. Then, he will be put in a room where basically the care will be taken. So, they are telling healthcare includes all the three things. When a person is diagnosed, treatment is done, and care is done. All the three are being covered in healthcare if it is relating to, sir, everyone, diagnose, treatment, and care. Healthcare means any services by way of diagnose, treatment, and care. For an example, one person was diagnosed that he have kidney stones. Diagnosis was done. That is also healthcare. So the lab, when they are going ahead and providing the services of diagnosis, lab is also giving healthcare service. He was taken to the hospital where the operation was done. That is the treatment. After the operation of the kidney stones, or you will not be thrown out from the hospital, you will be put in a bed, they will take care of you, juices will be given. That is care. Diagnose, treatment and care, all the three is being covered in healthcare if it is relating to pregnancy, any abnormality, any illness, any injury if you got, any deformity if you have. So, for an example, one mother is there, one lady was there, she was diagnosed that she is pregnant. When she went to the lab to get the diagnosis done, that diagnosis is also healthcare. Then her treatment was done. Might be when the baby was born, the treatment was done, the baby came to the world, and then care was taken. Means once the baby was born, the mother was kept in the hospital and care was taken. All the three are covered. Any person has abnormality, discovering the abnormality, treatment of the abnormality, care of the abnormality, all the three are covered. Any illness you got, sir, any injury you happened or any deformity happened, all the things, sir, if it is diagnosed, treatment and care with respect to pregnancy, abnormality, illness, injury, and deformity. They are telling Ramesh if it is diagnosed, treatment, and care of PAIID. And sir, always remember diagnose, treatment, and care for this thing should happen in a recognized system of medicine in India. What do you mean by recognized system of medicine? Which is recognized in India as a system of medicine. Sir, what are the recognized system? Recognized system is Ayushan. What is Ayushan, sir? A for Ayurveda. So if there is a doctor who is doing diagnose, treatment and care with the help of Ayurvedic medicine, he is doing healthcare service. If yoga, Baba Ramdev is going ahead and diagnosing a problem, treatment is given and the care is taken. He is going ahead and doing it. Yoga is also a recognized system. Then U for Unani treatment, which is given. Siddha treatment, which is given. Baba, Unani and Siddha treatment is all those Ayurvedic herbs, etc. is being used. Okay, everyone. I also don't know more about Unani and Siddha. Basically, it is that uh, herbs, etc., are being used in the treatment. Okay, everyone. H for homeopathy. That small white tablets are being given. Yes, sir. Homeopathy may, if somebody is diagnosed with a problem, treatment is given and care is given. That is also healthcare. And sir, allopathy, the English medicine, and N for naturopathy. Jindal Institute is there. Jindal goes ahead and treats people with the help of naturopathy. Naturopathic treatment is there. That is also covered in healthcare. And so, if anyone is going ahead and doing diagnose, treatment, or care of what, sir? Of pregnancy, abnormality, illness, injury, deformity, and sir, it is done in a recognized system of medicine, which is supposingly Ayurveda, sir, U for yoga, Unani treatment, Siddha treatment, then Ayushan, H for homeopathy, A for allopathy, and N for naturopathy, then it shall be exempted. Then it shall be exempted. Everyone, then it is healthcare. Now tell me one thing. One Baba is there. You went to the Baba and told Baba, I'm not feeling good. Baba told you are Baba told, you have some illness. Now I will do your care. Treatment he did. Now tell me one thing. Baba going ahead and doing all that treatment, care. Is it healthcare? That is not a recognized system of medicine. Always remember acupuncture, Chinese medicine, Reiki treatment, pranic healing, all these are not recognized system. And hence, if a person is practicing in acupuncture, Chinese medicine, Reiki, it is not healthcare, it shall not be exempted, it shall be taxable. Are we clear, everyone? Is the point clear to all? Did you guys understand the meaning of healthcare? Healthcare means diagnose, treatment, or care in PAIID, pregnancy, abnormality, illness, injury, and deformity in, and you are doing the diagnosis, treatment, and care using a recognized system of medicine, which is Ayushan, then it shall be exempt. I am going ahead and practicing Chinese medicine, stone treatment, and I am doing treatment of people, but I am not doing a recognize. I am not uh, doing diagnosis, treatment, or care in recognized system of medicine, and hence my service shall not be exempted. Next, sir, healthcare also includes services by way of transportation of patient to or fro a clinical establishment. One person was taken to the hospital. From the hospital, he was brought back home. The healthcare includes that ambulance ka services also. Ambulance ka services are also included in healthcare. Okay, sir. Healthcare does not include. What are the things not included in healthcare? Beautification. For an example, this is over here Jason. Jason is over here. Jason ka hairs are gone. Jason got beautification, hair transplant done. Government is telling Ramesh, if you can afford beautification, you can afford my GST also. Always remember, healthcare does not include hair transplant, cosmetic and plastic surgery. If it is for beautification, it shall always be taxable. For an example, one person met with an accident, or one person was born with a cleft lip. Lip was little problematic. It was a deformity which was there. Then, Baba, if plastic surgery is done, it is to restore him to normal. So, if restore or restructuring is done due to defect or injury, then it shall be exempt. Always remember one thing, everyone, hair transplant, cosmetic and plastic surgery, if it is for beautification, it is always taxable. But sir, hair transplant, one person met with an accident, hairs are gone from here, or might be a person met with an accident, the face has little problem, and now plastic surgery, cosmetic surgery is done just to restore him back to normal. then baba, that is healthcare and it shall be exempted. One kid was born with a cleft lip had some problem, and then the operation was done so that he can come back to normal, that will be exempted, it is healthcare. But you wanted your nose to be little big and you went ahead and got a plastic surgery, that is beautification, that is your extra demanding, and extra demands are always taxable. Are we clear, everyone? Quickly tell me, did you guys first of all understand what is healthcare? Yes, sir. You went ahead and told the meaning of healthcare. Everyone, healthcare services. What is healthcare? Always remember, healthcare means diagnose, treatment, and care of what, sir? Of PAIID. Pregnancy, abnormality, illness, injury, and deformity. In which field, sir? In Ayushan. A for Ayurveda, Yoga, Unani, Siddha, Homeopathy. A for allopathy, and N for naturopathy. Or it is transportation of patient to or fro a clinical establishment, or basically if you are going ahead and transporting patient to and fro, that is also exempted. That is also healthcare, and it does not include hair transplant which you have gone ahead and done for beautification, that is not healthcare. But if healthcare is done, but if you have gone ahead and done hair transplant, cosmetic plastic surgery for restoring something to normal, then baba, that shall be exempted because it is healthcare. Okay sir, we understood what is healthcare. Sir, listen to me very carefully. I am one person. I also give medicine. I am a compounder. I did not pass MBBS exam. I did not pass MBBS exam. Then, Baba, if healthcare services are provided me, will it be exam? No, Baba. Always remember, they have gone ahead and told healthcare services, if it is provided by whom? Healthcare services, services by way of healthcare which are provided by whom? Clinical establishment like hospital, nursing home, pathology labs are there where they go ahead and carry out diagnosis or investigation. Labs, when they are giving healthcare service, it shall be exempted. Sir, if one authorized medical practitioner, basically an individual doctor who is registered with the doctors ka council, he is going ahead and giving healthcare service, then it shall be exempt. Tell me one thing, I did not pass the medical ka exam. Okay, you know that I did not pass medical ka exam, and now I am holding one injection. You have some problem, one injection I will give. You have some problem, take this dolo. Baba, those people are not authorized medical practitioner. My question to you guys, if I am a person who is not an authorized medical practitioner, but because of my experience, I am sitting in a village and giving medicine. Am I giving healthcare services? Is my healthcare services exempt? Might be. I am also going ahead and doing diagnosis, treatment, and care of any abnormality, illness, and I am going ahead and doing treatment in allopathy only, which is recognized system. But is my services exempt from GST? Services of healthcare will be exempt if healthcare services are provided by clinical establishment, which is a hospital, nursing home, or a pathology lab which goes ahead and diagnose any problem. Sir, if it is provided by an authorized medical practitioner who is authorized MBBS doctor, he is registered with the council, only then his services shall be exempted. Are you guys able to understand this till here? Quickly tell me, everyone. Are we all clear till here? Are we all clear till here? Yes, sir. Healthcare services by clinical establishment or authorized medical practitioner is only exempted. Healthcare services, if they are provided by paramedics. Who are these paramedics, sir? Paramedics are not doctors. Paramedics are not doctors, but nurses, physiotherapist, technician, lab assistant. All these people are not doctor, but they go ahead and assist the doctor in providing healthcare service. And hence, paramedics going ahead and doing healthcare services like nurses, physiotherapists, technicians, lab assistant, although not doctor, but these are trained healthcare professional, and hence their services are also exempted. One person met with an accident. After the accident, diagnosed, treatment, and care, everything done. Now, physiotherapist comes and she goes ahead and does the treatment. Physiotherapist will go ahead and tell you, okay, now you move your hand like this. They will give you physiotherapy. Now, my question is, a physiotherapist is not a doctor. It is not an authorized medical practitioner, but physiotherapist is going ahead and helping the doctors with the healthcare services, and hence their services are also exempted. Paramedics providing healthcare services is also exempted from GST. Is my point clear to all? Yes, sir, we understood. So if there is a physiotherapist, technician, lab assistant, nurse, all their services are also healthcare and they shall be exempted. Okay, sir, got it. So services by way of healthcare service by whom? By clinical establishment, authorized medical practitioner, and paramedics who basically go ahead and put a cap. Sir, cap, CAP. Not every heroes wear a cap. Sir, doctors don't wear. Doctors wear cap? No, sir, doctors don't wear cap. So not every hero wears a cap. C for clinical establishment, A for authorized medical practitioner, and P for paramedics. Their services of healthcare shall be exempted. Yes, everyone, you would have gone ahead and seen this ad now during the COVID time that not every hero wears a cap for the doctor. So you can remember it like this, that a doctor doesn't wear a cap, but doctor ka services. Who are these people? Cap. Sir, clinical establishment. A for authorized medical practitioner and P for paramedics. Although they are not wearing a hat, although they are not wearing a cap, but they are still heroes of the country. They are going ahead and doing healthcare service and it shall be exempted. Are we clear till here, everyone? Quickly give me heads up. Are you all clear till here? Yes, sir, we are all clear till here. Now listen to me very carefully. One was healthcare services, which was exempted. Number two, in healthcare, for an example, now see, if a hospital is running an ambulance that is coming in diagnose, treatment, and care, it is exempted. Hospital going ahead and running. See, healthcare services by hospital. Healthcare includes transportation of patient. Healthcare includes transportation of patient to or fro a hospital, etc. So tell me one thing. If a hospital is running an ambulance, that is also covered in healthcare. If a nursing home is running an ambulance, that is also covered in healthcare. Lab is running an ambulance, that is also covered in healthcare. Authorized medical practitioner, doctor running a ambulance, that is also covered. Now my question is, what if I am an individual? I had one van. I thought in the COVID time, everyone will need ambulance to go to the hospital. I started operating an ambulance. My question is, am I a clinical establishment or an authorized medical practitioner going ahead and doing healthcare service that my ambulance shall be exempted? No. So they went ahead and specifically told, if anyone is doing transportation of patient in ambulance other than those which are covered in one, means you are not covered anywhere here, but you have individually started ambulance service in COVID time. Anyone needs ambulance service, I will go ahead and take them to hospital, bring them back home. Then baba, you are also going ahead and doing your services by way of not healthcare. You are not doing healthcare, but transportation of patient in ambulance. You are doing your services. Also, government is telling shall be exempted. Although they are not covered, you are going ahead and giving services by way of just transportation of patient. Your service also will be exempt. Hospital doing it is exempted. You individually doing it also shall be exempt. Next, everyone over here now. Now, if there is a veterinary clinic and there is a veterinary doctor who is there, services by a veterinary clinic in relation to healthcare of animals and birds. So there is a veterinary clinic in which there is a doctor who is going ahead and providing the service. The veterinary clinic ka services are always exempt. Services by a veterinary clinic. Baba, human ka healthcare, if you are doing, that is also exempt. Dogs, cat, etc. Their their care also you are doing, your services are exempt. They are going ahead and telling in relation to healthcare of animal also shall be exempt. Next, everyone over here now, services by biomedical waste treatment facility to a clinical establishment. Listen to me very carefully. What is a biomedical waste treatment facility? In the hospital, you will see there are bins which are kept, green bin, yellow bin, then blue bin. So what will happen in these bins which are there, dustbin which is there, they go ahead and put syringes, they put organ, waste, blood which is there, might be they are putting cotton, knife which they are using in the operation theater. All those things are put in these garbage bins. Can you go ahead and throw this garbage bin anywhere in the world? Can the hospital empty this garbage bin in the normal garbage collection vans? No. This garbage cannot be thrown here and there, because if you throw here and there can be diseases which can spread, and hence all these garbage bins are being taken away by these people who are known as biomedical waste treatment facility ka people. They will come, they will collect the bins and go, and they will do the treatment in their waste facility. The treatment, when it is done by the biomedical waste treatment facility, then that disease spreading etc will not happen, because their facility is designed in such a way. Now if I am a biomedical waste treatment facility, I am coming to your clinical establishment, collecting garbage and going and doing the biomedical waste treatment, I will charge you an amount. My amount which I am charging you shall be exempted. If you are a so services by a operator of biomedical waste treatment facility to a clinical establishment is exempted from GST. I will tell one thing. I am a pharmacy. I am a pharmacy. Biomedical waste treatment wala services giving to a pharmacy. Is it exempted? Is it exempted? Biomedical waste treatment facility giving services to a pharmacy. Is it exempted? Quickly tell me, is pharmacy a clinical establishment? No, 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 no. In the exam, they have asked this. They have told, I have already told you, clinical establishment means a hospital, nursing home, or a lab. Always remember, biomedical waste treatment facility given to clinical establishment is only exempted. If it is given to anyone other than a clinical establishment, it is not exempt, it is taxable. Be very careful in the exam. Got it, sir. Next, everyone over here now. Now, you know what happened? Services by code blood bank. There are blood banks which are there who are code blood bank. What do you mean by code blood bank, sir? Listen to me very carefully. When a baby is born, the baby is before the birth, the baby is connected with the mother with an umbilical cord. The umbilical cord which is there is basically connecting the mother and the baby. Now what happens once the baby comes out? Now the umbilical cord which is there is being cut and it is being preserved. Now there are specialized cord blood bank who go ahead, who will come to you. They will give you an application. You have to fill the application. They will collect the cord blood. Basically, they will go ahead and collect the stem cell. This is there, no? They will go ahead and collect this umbilical cord. They will preserve it. Now, why is it being preserved? So that in future, if the baby has any problem, this cord can be used and the baby cut treatment can be done. So these cord blood banks come and they collect this umbilical cord and go. Now when they are coming, they are not coming free of cost. They will charge you application charges, they will charge you collection fees, they will charge you preservation charges, because they are going ahead and preserving the stem cell. So for all the services, whatever the code blood bank is charging, they will not charge any GST. So whenever a baby is born, the baby is connected to the mother with the umbilical cord. Now there are code blood banks who go ahead and preserve this umbilical cord. Code blood bank services are exempted from GST. Services by code blood bank by way of preservation of stem cell or any other ancillary services like collection, application fees, preservation fees, all these services also shall be exempted from GST. Yes, sir, we got it. Let's go ahead. Everyone, there are some circulars in the healthcare sector which I have gone ahead and written over here. Listen to me very carefully. One person was diagnosed with a problem. One person was diagnosed with a problem. Then he was gone ahead and done treatment in the hospital. Now he is put in a room. Room ka rent which is being charged. People went ahead and asked, it's a five-star kind of a hospital. Room rent which is charged, is it exempted from GST? Yes, Baba. Care. When you are put in a room and your care is being done, that is covered in care. Diagnose, treatment, and when you are put in a room, room rent which is charged for care. They are taking care of you. So, sir, room rent charged to inpatient is also exempted because that is also covered in diagnose, treatment, and care. Got it, sir. Got it. Everyone listen to me very carefully. Sir, I was admitted. Okay, one person. Why you? Anyone. One person was admitted in a hospital. Now listen to me very carefully. Hospital has hired doctors. Doctor is being hired by the hospital and hospital pay the doctor. Now, my question is when doctors are employees, then it is neither supply of goods nor supply of service. But if doctors are providing services to the hospital not as an employee, then doctor ka services will it be exempt? Because doctors are providing services to the hospital, hospital is providing services to this patient. Are you guys able to understand? And hence the clarification came, they are actually doctors are providing services to the hospital and through the hospital to the patient, and when the hospital is paying them, it shall be exempted. There will be no GST on the services provided by these doctors to the hospital, because ultimately it is going to the patients only. Doctors or consultants are hired by hospital and hospital pays them, that shall also be exempted. Okay, sir. Whenever one person is admitted in a hospital, they will go ahead and charge 10,000 rupees might be advance. Now, out of this, 7,500 was for his diagnose and treatment. You know what happened? They retain 2,500 so that later might be what happens when you are in the hospital. This is called retention money. This is called retention money which they retain with themselves, because when you are in the hospital, you might go ahead and the nurse will come and they will go ahead and check your blood pressure. The nurse will come, they will give the thermometer and they will check what is your temperature, all those things will be there. So for that, some money is being retained. Now people went ahead and asked, what about the retained money? Government told retention money charged from patient is also covered in healthcare and that shall also be exempt from GST, because basically the retention money is also for taking care of the patient only. It is also for the care of the patient and it shall be exempted. Next. Sir, you know what? One person was admitted in the hospital. Everyone listen. One person was admitted in the hospital. Now, in the hospital, when one person is sleeping and he is aram se sitting over here, you know what the hospital will go ahead and do? The hospital will go ahead and give him one juice to drink. Sir, drink one juice. Now tell me one thing. The hospital will give food to eat. Now, if you go ahead and buy food outside, 5% GST is there. People asked one question. Sir, what about the food which is given to a patient? Arey, tell me one thing. Did you go to the hospital to enjoy a picnic over there? Huh? It is some picnic going on. Sir, I had been, not why should I? The person had been to the hospital to go to do what? Sir, he was not there in the hospital to enjoy. He was there to help take healthcare services. Food was provided along with the healthcare service. Healthcare is exempted. Food which is given to the patient, juices which are given to the patient also shall be exempted from GST. Did you guys understand? Because healthcare is principal, food is ancillary over here. Are we clear, everyone? Yes, sir. Food is also provided for care of the patient only. It shall also be exempted. Is my point clear to all? Quickly tell me, everyone. Are you all clear till here? Yes, sir. Food which is given to the inpatient is also exempted from GST. Now, I'll ask you one question. One person was admitted in the hospital. More than this person, when one person is admitted in the hospital, the relatives will be very worried. Okay, so listen to me very carefully. What happened over here? This person ka, 1 minute. Huh. This person ka all the relatives came. All the relatives came to meet you. What happened? You met with an accident. There will be relatives who will be dangerous. There will be relatives who will be good. You know, all the relatives who will come to meet you in the hospital, the canteen which is there, they will go to eat over there. Okay? Now, my question is, when the relatives came, when the doctors who have gone ahead and done your treatment, there will be doctors who would have gone ahead and done the treatment. There will be nurses, etc. All these people also will go to the restaurant or the canteen which is in the hospital. Now, my question is, when canteens go ahead and give them food, is it also exempted from GST? Quickly tell me, when the relatives, the doctor or the nurses go to the canteen to eat, is the canteen going ahead and giving them healthcare services? No, sir, that time it shall be taxable. So always remember everyone, food which is given to inpatient, the patient is eating the food, that is exempted from GST, but food to inpatient is composite supply bundled with healthcare exempted, but food to outpatient or attendants or visitor is always GST payable. Everyone tell me one thing. Inpatient means a person who is admitted in the hospital. Okay? You know what happened? One person casually went to the hospital. In the hospital, one canteen was there. One person walked into the hospital. They told, sir, the doctor is little busy. Can you wait? He told, who will wait? He went to the canteen to eat food. My question to you over here is, he is an outpatient. Outpatient means he is not admitted in the hospital yet. He just went to the hospital to get a checkup done. When the doctor was busy, he went to the canteen to eat food. Now my question is it taxable or exempted? Quickly tell me everyone. Quickly tell me, is it taxable or exempted? Sir, here it shall be taxable because it is not provided to an inpatient. This person is not given any healthcare services and it is not a bundled service which is given that along with the doctor we give food also. And hence, food given to outpatient, attendants, visitors, always GST is payable. Got it, sir? Let's go ahead. Everyone over here. Ambulance by private service provider under National Health Mission. You would have seen people running ambulance under 108. Call 108 for ambulance. Basically, I had one van which was there. I put it under 108 and I am also running an ambulance. They are telling if it is under National Health Mission. Anyways, it is exempted under entry number 3 or 3A. Basically, if one person is going ahead and helping the government in doing those activities which are told in 243 G and W, article number 243 G and W of the constitution goes ahead and says a panchayat or municipality should go ahead and provide all these ambulance services to the people who need. So if I am going in and helping the government in doing those activities which are told under 243 G and W, my activity also shall be exempted. Are we clear, everyone? It is exempted under entry number 3 or 3A. Sir, where is it told? If you go to your government wala chart, everyone see over here, if government is, if anyone is providing a pure service to the government, sir, if anyone is providing a pure service to the government to go ahead and do those things which are told in 243 G and W, government ka objective, basically panchayat and municipality should carry out those activities which are told in 243 G and W. If I am going ahead and helping the government in providing 243 G and W ka services, then my services to the government also shall be exempt. So everyone over here. So if a person is going ahead and running an ambulance under 108, he is basically his services also shall be exempted. Ambulance services by private service provider under National Health Mission is also exempt. Tell me one thing, everyone. In one hospital, one auditorium is there. Hospital gives the auditorium on rent. In one hospital, one pharmacy is there. The shop is there. The hospital gave the shop on rent. In the hospital, there will be televisions where advertisement will be running. Hospital has gone ahead and allowed people to put their advertisement. Advertisement service is provided by the hospital. Is it healthcare that it will be exempted? Is it healthcare service, everyone? Quickly tell me, is it healthcare service? No. A hospital running advertisements, a hospital giving auditoriums on rent, a hospital giving shops on rent shall not be exempt. It shall always be taxable. Remember always, clinical establishment giving shop, auditorium, displaying of advertisement, always taxable, everyone. Don't forget, it shall always be taxable. Here we are done. Here we are done with your healthcare services.